Assalamu alaikum and good afternoon. I will keep it short and sweet. Lunch is waiting. All right. So this is the first time that Malaysia has been involved in a dengue efficacy trial. I mean, first time involved in efficacy audit on Malaysia. It's why I'm involved in this, although I'm a neurologist. But as chief statistician, we have to show that Malaysia can conduct a dengue or a vaccine efficacy trial. So these are the countries involved. The dengue vaccine is actually a chimeric vaccine. We've got a yellow fever coat, and then we've got the 4 dengue serotypes inside. So the vaccine is a tetravalent vaccine. Now, looking at the study design, we actually selected the countries which have got the highest incidence of dengue. And if you look at that, Malaysia actually qualifies because we are in the top 10 in terms of the dengue incidence, right? That's why we are one of the countries selected for this trial. The other countries in the ASEAN region are Thailand, Philippines, Vietnam, and Indonesia. Now, what was the trial design? Basically, we had the control group and the vaccine group, and we selected children in our study 2 to 14 years of age who are otherwise well, and but no plans to leave the study area for the next 6 years, because this study is going to go on for 6 years. We've now just finished 3 years, right? So another 3 years to go. And those are the exclusion criterion. Basically, at recruitment, we then randomized the children. 2/3 of them will receive the vaccine, 1/3 will go into the control group, and we gave the injections at 0, 6, and 12 months. And then we are actually presenting the results of follow-up from 1 month after the last dose until 1 year after the last dose, which is 25 months from 0. Okay? And in the active phase, which I will discuss later on, is the active phase actually has come to an end, and the results of today are actually the results of the active phase. We have an ongoing hospital phase, which is going to go on for until the end of 6 years. So in the active phase, wrong button. Okay, so in the active phase, we actually make weekly contacts with the patients or the patient's families and remind them to come to hospital if they have a fever of more than 30 degrees centigrade for more than 24 hours. Right? So this is why it's kept in regular contact, and if they have a fever, they will come to us and we will take acute and convalescent blood to make sure that the fever is not due to dengue. And we also have a backup system of looking at school absenteeism in case the families don't come nonetheless. Hospital phase, which is what now we depend on self-reporting of the family of any admission to hospital, any febrile illness. We in Malaysia actually are continuing to give them a 1 monthly reminder because our families don't seem to remember very well, so we give them a monthly reminder to remind them nonetheless to come whenever there's a fever and the child's hospitalized, let us know about it. Now, in terms of the numbers which we're going to report, if you look at the number of subjects we had in our study, 10,275 subjects, of which 3 did not actually receive the vaccine product. So the intention to treat population is 10,272. Again, 2-to-1 ratio between the vaccine group and the control group. And this is the group that we're analyzing from the point of efficacy and safety analysis. Then there's a population that actually completed the study and received 3 doses of the vaccine, the so-called pro-protocol population. And if you look at it, actually, they're quite similar in numbers. Again, vaccine to control is 2-to-1 ratio. There's a subset of children which we looked at more intently in terms of we took more blood samples from them to look at their antibody responses and also the reactogenicity of these children to the vaccine. This, again, was also 2-to-1 ratio. Sorry, am I going the wrong direction? Yeah. Okay, so the primary endpoint of the study actually is to look at virally confirmed dengue, right? Between 13 months, which is 1 month after the last dose, and 1 year after the last dose. So this is actually the endpoints of the study to look at virology confirmed dengue any period during this period of time and to compare the vaccine group with the control group, right? This is the things which we looked for, as I mentioned before, acute fever illness, more than 2 consecutive days, and all of them had acute and convalescent samples to confirm the etiology of the febrile illness. In addition to looking at the primary endpoint, we also looked at the intention to treat analysis, which is those who had just 1 dose of the vaccine product, all right? And then we also look at all children who had any sort of serotype differences between the population. I'll come to the next slide. We look at immunogenicity, which is the antibody, antibody to the children. We took blood at baseline and 1 month after the second, 1 month after the third dose. Right? And now we're taking blood from them every year to see that the antibody response actually is sustained. Then, of course, there's the safety profile which we're looking at in all the population, whether it was received 1 dose or more than 1 dose, to look at the safety of the vaccine. Then secondly, we're looking at vaccine efficacy based on age. And this is important because some things have come out of this, which I'll discuss later. We're looking at the 2 to 5, 6 to 11, and 12 to 14 years by country and by baseline status. Right, so looking at the risk of hospitalization for severe dengue. We're looking at the vaccine efficacy against dengue hemorrhagic fever based on the 1997 criterion, and also on severe dengue assessed by the Independent Data Monitoring Committee. And they're using a criterion more similar to WHO 2009 criterion, actually. All right, so if you look at the severe dengue, you find that actually the number of severe dengue WHO, this is the number, but they use the identification criterion, actually it's more inclusive. And I think some people have actually mentioned that this is actually more sensitive to picking up severe dengue, the 2009 criterion. So what are the results of the study so far? We find that 98.8% of the population completed the full immunization schedule. And this is a relief for us in Malaysia that our population actually cooperated and they've come along for that. Right? So 0.8% dropout rate during the first 2 years of active dengue surveillance, and only 2.1% of the total subjects were excluded from the protocol analysis. So if you look at this in terms of the integrity of the study, you find that almost in almost all the cases, dengue, they were reported within 5 days. A blood sample was taken. This is a requirement. And only 1% of them did not have a blood sample taken on time. And of course, mentioned 3 patients didn't actually get the vaccine product subject. Sorry. I won't dwell on this because time is short, but this is the comparing the vaccine group and the control group. Essentially speaking, they are comparable in the overall analysis as well in the subset of the immunogenicity analysis. All right. Now, if you look at the protocol analysis, you look at those who sorry. If you look at those who, the primary endpoint, that is those who received 3 doses and were followed up between 13 months and onwards, you notice that there's a clear divergence between those who received the vaccine and those who did not receive the vaccine in terms of the dengue incidence. So if you look at the incidence data, it is intensity, it is 1.8 for the vaccine group and 4.1 for the control group, and this gives you a vaccine efficacy of 56.5. Most pediatricians are used to vaccine efficacies of 90% and above. So we're not very excited about 56.5. All right? So this is one thing we need to keep in mind, that this has not been the figures, but as mentioned earlier, this is the first time we've had a dengue vaccine that works. So this is as far as I can say. I mean, first of all, it's a pediatrician, all right? So, but so I think most of us understand what this implies in terms of national programs. Okay, so but if you look at the intention to treat analysis, you notice that even after the second dose, the curves tend to diverge, and we'll discuss this later on. Why is it that you get a good response even after the second dose? In terms of the serotypes that we have, you notice that there were the serotypes circulating in the countries involved all 4 serotypes are present throughout the study and different proportions in different countries throughout this period of time. All right, so in terms of the protection based on protocol analysis, you notice the protection actually is quite good for dengue 3 and dengue 4. Not so good for dengue 1 and less good actually for dengue 2. In fact, dengue 2 protocol analysis actually the confidence interval actually crosses 0. Yeah? So some cause for concern. The good news is that in the Central American study just out, which was 20,000 subjects, here it is 43% and the confidence interval is a bit narrower. So overall, I think that is not as bad as we thought it might be. All right. So if you look in terms of protection against severe dengue, then you notice that there is a fairly good protection against severe dengue. Now, suppose if you're concerned from the point of a program of actually preventing severe dengue as opposed to preventing all dengue, then this is something to take note. That the vaccine actually has 88.5% efficacy against severe dengue. All right, and this is something which I think is what we will have to take into account when we're talking of this vaccine in terms of EPI, what is impact on severe dengue. All right, so this is the IDMCI guidelines will use a bit more inclusive sort of involvement of patients, and therefore they have higher number of patients with severe dengue, and even then the protections were 80%. So that is not too bad. That's not too bad. All right. Now, if you look at hospitalized cases, again, you find that the relative risk for hospitalization is much lower for those who've got the vaccine. Risk of hemorrhage, risk of plasma leakage, all the things that some of you were discussing earlier this morning. The risk actually is much lower in those who have received the vaccine as compared to the control group. In terms of shock, no difference. In terms of shock, no, but only 2 patients in group A. It's not easy to comment on that. It was a bit small. Now, in terms of efficacy across the country, Malaysia, we actually not many cases of dengue in either the vaccine or the control. Therefore, we have got the highest protection rate in the region of over 80%. All right, whereas other countries, the protection rate is hovering around 50%. All right, so this is interesting that it seems to do better in our country than other countries in the neighborhood. Now, this is important. One of the concerns of a dengue vaccine was enhancement of disease, isn't it, if you expose them to the dengue virus. But actually, we found the opposite. We found that those who at baseline had seropositivity for dengue, that is the old age group, were the ones with the higher protection rate, higher efficacy. So it does appear that previous exposure to dengue actually increases the vaccine efficacy. And in fact, in those who are above 11 years, there's no added benefit beyond the second dose. So 2 doses appear to be enough for those who are in the 12 to 14 age group. So this is important, that baseline dengue status can confer better vaccine efficacy in the older age population. In Malaysia, we're not too sure who we're going to get the vaccine to, but chances we give young adults rather than children. So this might have a reflection that we might just get it with 2 doses. All right. In terms of the reactivity, look at the side effects. Actually, not much difference between the control and the vaccine group. In terms of serious adverse events, again, comparable. There were 4 deaths in the vaccine group, but due to traffic accidents and traffic injury unrelated to the vaccine in any way. The only thing is, in terms of the antibody response, there was a clear benefit of the vaccine in terms of antibody response after the second injection and after the third injection as compared to the control group. So in conclusion, we have achieved the primary endpoints which we set out to achieve, in the sense that the vaccine has 56.5% efficacy against all serotypes. There is and also a fairly good efficacy against dengue hemorrhagic fever. Now that we have pooled the data between the 2 studies, we can try and see whether this efficacy will also independent of serotype. In other words, the question we're asking is it 8.5%, is it for all serotypes or only for some serotypes? And we need to maybe pool the data from our study and the American study to track some meaningful numbers to look at dengue vaccine efficacy against severe dengue. So this, I think, is what I'm going to stress. I'm not going to go on this, because I think most of you are already a bit hungry. So the good thing is that this is a product which we can look forward to using maybe in selected populations of the country. I don't see this as being part of EPA for pediatrics. We need to see what is the role of this vaccine in the overall dengue prevention program. All right, so we have some even more encouraging results from the Central American study, which will indicate that this vaccine has a role in the overall control of dengue. It's a question of defining which is the target group that might benefit from this vaccine most of all. Thank you very much.